Good afternoon, everyone. Welcome to today's Facebook Q&A session with myself, Steve Maddern. I'm the Director of Public Health for Swindon Borough Council. Before we get into the detail of today's discussion around COVID in Swindon, just a brief reminder that this is a pre-recorded session that will be put out live at a later time, hopefully on the same day. So you will get as live as information as I can provide you. So thank you to Swindon residents that have already responded with a number of questions for me to answer today, and I hope that I can respond to those appropriately, along with giving you an update in regard to the COVID situation in Swindon. So if we start with the context here, I think we are all fully aware that the government announced on Monday this week, the 12th of July, that we will be moving to step 4 of the roadmap out of lockdown as of Monday, the 19th of July next week. So step 4 will see a relaxation of many of the COVID-19 guidelines and measures that have been legal across the last year and additional months. And have been supporting us to fight against COVID and prevent onward spread. In regard to the current status in Swindon, the case rate, we are seeing an increase. So the case numbers in Swindon, or the case rate in Swindon as of yesterday, was 238.2 per 100,000. In comparison to the Southwest, their case rate is currently 269.7 per 100,000, and the England average at the moment is 333.7 per 100,000. What that means in regards to numbers is that we're seeing that increase across not only local, regional, but also national levels. So for Swindon, that case rate is a 77% increase in numbers that we saw compared to the previous 7 days. And similarly, the Southwest is seeing a 40% increase and a 30% increase at national level. Unusually for Swindon, we normally have spent a lot of our time at the top of the leaderboard in regard to COVID case rates across the Southwest, but we aren't faring too badly at this moment in time, currently with the 5th lowest case rate across the Southwest. What that means in regard to numbers is that's 531 new cases we've seen across the last 7 days, which brings the total number of cases in Swindon since the start of the pandemic to 13,050 cases. In slightly better news, our death numbers have remained static for a number of weeks now. So our current death figure is 270 deaths related to a COVID-19 status within 28 days. The majority of the deaths seen across Swindon reflect that of the regional and national picture, with a significant loss of lives at the start of the pandemic and in January 2021. So I know that one of our residents is keen to know a little bit more about the cases in Swindon. So what do we know about how it looks across the borough? So what we need to remember is that the cases in the over 60s are low, but they are rising ever so slightly. And this will be a real testimony to our vaccine programme in protecting those people that are older and most vulnerable. We know at this moment in time, as I said, we've had just over 500 cases in the last 7 days. Over 76% of those cases are in the under 40s, with around 47% of those cases being in the 18 to 25-year-old category. So that is the majority of the cases we're seeing at this moment in time. Another resident has asked, why are we still seeing the rates climb if so many are vaccinated? And the reason for that is because we're seeing much more cases in the younger age groups that are currently not as vaccinated as the older age groups and are more likely to be socializing and mixing. We know that the majority of cases are male, which increases from 52 to 58% as the cases' ages increase. And this is quite different to what we saw across the rest of the pandemic, which has been largely female cases. From an ethnicity perspective, we know that 85% of cases would define themselves as coming from a white background, and 8% of cases would define themselves as having Asian heritage. What we are seeing is a spread of cases across the borough, so not concentrated in any specific area, but the majority of cases we're seeing at the moment are in SN3, SN4, SN6 and SN25. And again, a little bit atypical to the situation we've seen across the most of the pandemic is we've actually seen quite a significant decrease in cases in the SN1 and SN2 communities. We know that we've been managing a small number of Delta variant cases, which have accounted for around about 13% of cases in Swindon across the last 2 weeks. So although Delta has become the dominant variant of concern in England, it is not currently the most dominant variant that we're seeing in Swindon, which is a really positive thing to see because we know that there's a higher rate of transmissibility linked to that variant. So in regard to vaccination, the latest vaccination update. So for across Swindon, we know that 153,306 people have received their first dose, and then subsequently 108,978 people have then gone on to receive their second dose. That to us suggests that 80% of our eligible adult population have had their first dose, followed by 57% have had their second dose. We're seeing great uptake in the over 40s, but slightly lower uptake in the under 40s, but very mindful that we only launched the 18 plus programme a few weeks ago. So if you haven't booked for your vaccination yet, there's still opportunity to do so. Please go to the NHS portal to book or via NHS 119. Also, keep an eye out on social media for our COVID vaccination bus, which will be touring Swindon across the next few weekends to support people to access their vaccine if aged over 40. It's just an opportunity to remind people that vaccination is not mandatory, but may not stop you from catching COVID-19, but will help to prevent severe illness and premature death. We want to make sure that anyone that has their vaccine can make an informed choice as to whether the vaccine is appropriate for them or not. So I would encourage people to read the information online available from reliable sources such as the NHS website, or if unsure, to speak to a healthcare professional about whether the vaccine's right for you. So that's a brief update in regard to the current state of play in regard to COVID-19 across Swindon. And now I've got a series of questions that I hope to be able to answer for you that have come in from residents across the borough. So without further ado, let's start. So the first one is, do I need to wear a face covering in a shop or on public transport? So as we know, as of Monday the 19th of July, the legal requirement to wear face mask will be lifted in all settings, but we know that wearing a face mask can help you to protect others, and so we would still be encouraging, if you're in indoor crowded areas or using public transport, to continue to consider wearing a mask in those settings, remembering a mask helps you to protect others and other people wearing masks helps them to protect you. The next question is, can I go back to work? So again, it is no longer necessary from the government perspective to instruct people to stay safe and work at home. The key thing here is very much a case of having an understanding that your employer has a responsibility to protect your health and well-being from COVID and other things. We know that the furlough scheme stays in place until the end of September, so that may be an option for you, particularly if you're clinically extremely vulnerable, and I'll talk a little bit more about that later. All employers will have a responsibility to protecting your health and well-being, so please ask your employer what steps they will keep in place to make sure that they you be returning back to the workplace. The next question is, how many people can I have in my house? So again, the removal of restriction means that there will be no limit on the number of people that you can meet inside your home or inside your private garden. The key thing is making a decision and a risk assessment yourself as to how many people you feel comfortable having within your home, and to make sure that you've got the steps and measures in place to try and keep any potential risk of COVID to a minimum, including keeping windows and doors open for ventilation and trying to maintain a degree of space between each other. Will there be any changes to social distancing? So, as we know, we have been focusing on keeping socially distanced throughout the pandemic. The requirement to be socially distanced will be removed, but just because the legal requirement is being removed doesn't mean that you shouldn't consider doing it. There will be certain settings, such as ports of entry, like airports, where social distancing will still be required. But in general, you will not need to do so. But again, please make the decision as to how comfortable you feel being closer to other people, as that will still increase your risk of contracting COVID-19. The next question is, will I still need to check in when I visit a pub or restaurant? So again, the legal requirement to check in will no longer be there. However, we will be encouraging businesses to continue to record this information, particularly as it allows to support us should there be any outbreak situations. So although not a legal requirement to do so, businesses may still undertake such activities, again, to protect you as customers, but also their staff as well. It also helps my team as the public health team in supporting any outbreaks should they occur. Linked to businesses, pubs and restaurants. The next question is, will restaurants and pubs still be doing table service? So again, the requirement to do so will no longer be in place. However, some businesses may continue to choose to do so in line with their own policies in protecting customers and protecting staff, but the legal requirement will go. What are the rules around larger events? So we know that all restrictions on life events such as weddings, funerals, and any other life celebrations will be removed. So that means there's no restriction on the number of attendees. There will also be no requirements for table service at such events, and there will be no restriction in regard to singing or dancing. And we know that the majority of other settings such as pubs, clubs and bars will also be able to open as well. Linked to talking about singing and dancing, the next question is about, will music groups of any size be able to meet indoors to play and sing? So again, the restriction on size numbers is being removed, but I would be encouraging people to still consider the COVID-19 guidelines when they are planning their activities. We know that certain activities such as singing increases the risk of COVID transmission. So steps like regular testing, social distancing, and the ventilation of the space being used can all help to reduce that risk. We can't remove the risk completely, but we can help but lower it. The next question is can I go clubbing? So yes, venues as of the 19th of July will be able to open, but they must ensure that they are following current government guidelines and any restrictions that the venue may wish to put in place, again, to protect you and to protect others. So there may not be a legal requirement for you to follow such restrictions, but there may be venue imposed requirements. So please check with the venue that you're attending as to what those requirements are. The next question is, will I still be able to get free COVID tests? So yes, absolutely. At this moment in time, COVID testing is still freely available throughout Swindon. We have 3 main sites where you can get a symptomatic test, and there are a number of sites across Swindon, including online, where you can order your symptom-free testing. And again, we encourage people to do that at least twice a week. We also know that in certain settings, such as education, and higher risk settings, such as the NHS and care homes, that regular testing for staff and residents will also continue as well. So if you want to know more about testing, then you can visit the Swindon website, swindon.gov.uk/coronavirus, which will give you more information regarding our local testing offer. The next question is all test and trace still in place? So yes, absolutely. That is one of the government commitments, that the requirement to test, trace and isolate will remain in place for the foreseeable future. So this is very much around providing contact information of people that you've come into contact with to ensure that they are self-isolating as a result of becoming a close contact in regard to COVID-19. What is the change if my child tests positive for COVID whilst in school? So at this moment in time, if your child or anyone in your child's bubble at school tests positive, there is a need for that child and children to have to self-isolate. From step 4, bubbling in schools will end, and we will then eventually see that children under the age of 18 will no longer need to self-isolate should they come into contact with positive child cases. But please bear with us whilst we wait for further information from the government, and we will make sure that we cascade that through schools and to parents as well. So what advice is available for people identified as clinically extremely vulnerable, given that mask wearing and on public transport and in shops is no longer mandatory? So we're very mindful that this is an incredibly anxious time for a lot of people, and I've got some advice to provide in regard to that shortly. But when we're talking about clinically extremely vulnerable, what we need to remember is that the requirement to shield was suspended or paused as of the 1st of April this year, and moving forward with step 4 of the roadmap means that those that are clinically extremely vulnerable can continue to live their lives within our communities, but there are some additional things that you may want to be thinking about as you start to get your life back to some form of normality. So the key thing around this is very much around vaccination. So again, it's about taking the opportunity to look at the information available and determine whether vaccination is right for you. And if it is, then 2 doses will offer you the maximum protection. In regard to socializing, you may want to think about limiting the close contact that you have, particularly with people that you don't usually meet with. You may want to consider whether you or those that you are meeting have been vaccinated, and if you have full vaccination status, which means that you have waited until at least 14 days after your second dose, as we know that this is where full protection then begins. We would still encourage you to meet outside if possible. We know that the risk is significantly lower if you're meeting outside, and if you're meeting people inside, then make sure that you well ventilate your space. We know that the COVID transmission can reduce quite significantly if you ventilate your space by opening windows and doors. We would continue to encourage the regular washing of hands, and particularly any touch points within your home. So if your visitors are using, for example, your kitchen facilities or your bathrooms, make sure that door handles, etc., anything people are touching, are cleaned on a regular basis. If you are out and about, you may want to consider going out at quieter times, particularly if you're going to the shops or to pharmacies, and you may wish to continue social distancing as a way of, again, reducing your risk, along with that additional mask wearing as well. If you do have people visiting your home, you may want to consider asking them to take a lateral flow test before visiting you, again, just as another opportunity to keep the risk low. As I've talked about earlier in this session, in regard to working, you are no longer instructed to work from home, but your employer does have a role to keep you safe. So do speak to them about what they can do to assist you. As I've already mentioned, furlough is available until the 30th of September if your employer agrees. So do have a chat with them, particularly if you are feeling anxious about returning to the workplace. Full advice for clinically extremely vulnerable people is available online from the gov.uk website, and guidance specifically from the 19th of July, as I've outlined now, is available there also in more detail. So the next question is, what about care home residents? What guidance for visiting care homes after stage 4 of the roadmap? So we know that restrictions will formally be lifted, but individual care homes may continue to keep some of the measures in place to protect residents and staff in line with current COVID guidelines. We know that vaccination of residents and staff will continue along with regular symptom-free testing, and those who are visiting the home themselves may also wish to consider their own vaccine status, and we would encourage lateral flow testing before visiting as well. So all these things, along with what the care homes are doing, can help protect residents, staff, but also visitors, and that's really important. So what about travel advice? Can you go abroad on holiday? So the best thing to do would be to look at the gov.uk website /travel abroad. This will give you further information regarding the current traffic light system that we have in place in England at this time. If you visit green list countries, you will not need to self-isolate on your return. If you currently return from an amber list country, you will need to self-isolate, but guidance is likely to be changing in August, which means that if you are fully vaccinated, so that's having a second dose plus 14 days, then you will not need to self-isolate when you return. If you are traveling to or from a red list country, and traveling to red list countries again is extremely discouraged at this moment in time, then you will need to self-isolate in one of the government identified quarantine hotels for 10 days. So please look at the gov.uk website for further information regarding travelling should you wish to go abroad this summer or beyond. So I'm nearly at the end, you'll be very happy to know. So a couple of final questions is around, why is the case rate in Swindon still climbing if so many are vaccinated? So I think we've covered this as an early part of the discussion, and as we know, the majority of our cases are in the is in the under 40s, and actually around 50% of those cases then are in the 15 to 24 year age group. We know that that group is the group that is least likely to be vaccinated at the moment, and most likely to be mixing more socially. So that is the main reason. What we also know from our cases is that when you get a COVID case within the home or the household, then you are very likely to be infecting other people. So again, advice and guidance is available online around how to try and manage COVID should you have a case within the home, and trying to prevent that onward spread. In regard to the Delta variant, which we've talked about, so we know that the Delta variant in Swindon overall has been relatively quite low, but we have seen cases. So again, across the last 2 weeks, only 13% of cases have been identified as the Delta variant. A question is around, why are we not taking into account the different symptoms in relation to the Delta variant? And again, this is very much linked to the national case definition of what COVID is. We have asked whether Public Health England or the government are considering changing the case definition, and it has been confirmed that at this moment in time they are not. So please remember, the key symptoms to look out for is that temperature, that new persistent cough, and that loss of taste or smell. No matter how mild, we would then encourage you to be testing using a symptomatic PCR test, not a lateral flow, and then isolating accordingly. That's really important. We do recognise that there are wider symptoms related to COVID-19, but they are not recognised as part of the current case definition in England at this time. So to bring this to a close, because I think I've probably talked enough and I have answered about 20 questions for you, and I hope that's given you some really key answers ahead of the 19th of July and hopefully given you a bit more insight into the current cases in Swindon. We know that many people will be looking forward to the lifting of restriction, and the government has stated that following the behaviours around preventing COVID is really beneficial. It's really putting the emphasis back on you. Just because the legal restriction is being removed doesn't mean that you should consider not following the consistent guidance around hands, face, space and ventilate to protect you and others around you. The case rates are rising and they will continue to rise. So please, please make sure you're doing everything you can to protect yourself and to protect others. My final parting message is to think twice. So we know that the key strategy at the moment is very much around focusing around vaccination. So if you are considering your vaccination and you think it's right for you, make sure you have both doses and make sure that you are regularly using your lateral flow testing at least twice a week. If you're anxious about the next steps of the government roadmap, and I'm sure many of you are, as am I as well, we're going into a bit of an unknown. But we know that the view from the national policymakers is that now is as good a time as any to remove these restrictions. Then please search Every Mind Matters, which is an NHS website, which will provide you with some top tips, information and advice on how to manage your anxiety. I would like to just take this opportunity to thank all of you, be that health and social care workers, people working in the local authority, or our broader partners across the system for everything that you've done across the last 14 to 16 months to help protect the population of Swindon. But also a huge sincere thank you to all Swindon residents that have listened to the advice and guidance and applied it in their day-to-day lives to protect themselves and to protect others. I hope you look after yourselves and each other as we go through these next few months. And I will provide ongoing updates as we have done throughout the pandemic. So remember, Swindon, it's up to all of us.